There are so many miscommunication and misunderstanding among the parents. When to take action, what kind of medicine should you give? You have a seasonal change during that time. There is cold and cough. There is virus everywhere. For example, you have a family when there is a child there. You have another family member having cold and cough. It is going to be seconds or minutes. The child is going to get exposed to that air. As soon as the child has a cold, cough, they go for antibiotics. The moment a child has a fever, what do you mean by fever? Fever is a rise in the body temperature. Antibiotic does not work for viral infections, for flus. Even to me, parents are very anxious. Nowadays parents choose, AC malls, AC indoor place, AC schools, thinking that this is going to protect my child, this is a safe environment, but not.
Hi, Dr. Gayatri. Doctor, you are a third generation homeopath, which means that after your grandfather, your father was a homeopath, and now you are. And you've been sharing your expertise and your knowledge and of cure through homeopathy with your patients for over 18 years now. Please tell me something about yourself.
Hi Rashmi, thank you so much for bringing me here. It's my pleasure to be here with you today. So yes, about myself, yes, I'm Dr. Gayatri, and I finished my graduation around 2006, and after which I've started my practice. And my mother is a homeopath, and my grandfather is also a homeopath. My grandfather, being an allopath turned homeopath, he was a gynecologist and an army doctor as well. So after losing hope in allopathy, somehow he started his homeopathic practice, and that is when he wanted his daughter to be on the same line. And with me, actually, nobody told me that you have to become a homeopath or whatever. Probably I would believe that it's my destiny, and from my younger age I would always, they ask like, what is your ambition when we are young in our schools, like, I even remember now that I wrote that I want to become a homeopathic doctor. Probably the amount of benefit that as a child I had taken through homeopathy, because as a child I was growing, I didn't even know there was another system of medicine that existed. So there was no vaccine for me. I've always been brought through homeopathy for every of my infections, whether it is small or bigger. My family, though we were a family where we had doctors in other system of medicine, my mother's elder sister was a gynec, and we had so many doctors around. Everybody, their first line of treatment would be through homeopathy for their infections or whatever health issues. So probably I would tell that it's that love of homeopathy that I had from a younger age, which has brought me here today. And I somehow feel my soul is actually filled in with lot of love to this system, where I'm able to heal people gently, holistically, without any side effects and all of it.
Doctor, do you remember what was the reason? Because allopaths recommending homeopathy itself is a very big, I rarely come across doctors who subscribe to alternate mode of medication. Your grandfather shifted his entire perspective or his practice strategy from allopathy to homeopathy. Do you know what was the trigger that caused this?
Probably, even the founder of homeopathy, Samuel Hahnemann, we call him, like, he was also an allopath. There are so many allopaths who are turned into homeopaths because, probably, the basic, it's not something to complain about allopathy. It is also, an equal system of medicine we respect. It has, given lives to so many people. But still, the approach of allopathy is to, to take out a pain, it again give another pain. Right. So probably my grandfather wasn't happy about it. So it was his interest, like he wanted to treat people in his own way, the way he liked. So he took homeopathy and he studied that. He has lots of books. So he did a lot of research, and he was a very renowned homeopath during that time, treating very famous politicians and all of it. So I'm so happy I'm that in that family, taking that legacy now here.
Doctor, I got introduced to homeopathy as a child when I developed tonsillitis, and I was told to surgically remove it. And my father refused to accept it, and he said, "No, that every organ of your body at some point in life you will have a problem, right? How many organs will you remove and discard?" So that is when I got introduced to homeopathy, and I think. I see what is your perspective on children and homeopathy? I mean, what is the trend that you're seeing with respect to children today?
So such a wonderful topic that we are able to talk here today, because there are a lot of miscommunication, misunderstanding about the children, their health, their immune system, when to take action, what kind of medicine should you give, when to give. There are so many miscommunication and misunderstanding among the parents, which I would really want to address. To start this, I would really want to take people to the root, to make them understand what is immune system in a child. you know See, talking about the immune system, immune system is our defense mechanism. You can call it as our police force, or your security guard, or whatever. It's a 24/7 defense mechanism that's working inside you, outside you, all through, which is protecting you from anything which is going to affect your body's circadian rhythm, or your body's balance, or whatever, from pathogens, viruses, bacteria, germs, anything. It is working 24/7. But in children, this immune system is still developing, especially during the early years. It is not fully developed, as in like with us. But in children, it is not fully developed. It is, during those early years, it takes that development. And that is why the children are more prone to infections during the early years. Okay, so I'll just take you through a journey where how this immune system is instilled in a why people say, like, the mother should be healthy for a child to be having a healthy immune system. See, the mother's immune system is the first line of defense. Even the child is born, even before born, the child is, even the child is born, it is like, the mother's immune system, the mother's antibodies are playing a very vital role. The child is taking the immune system through the mother. Okay, and then after they are born, it is through their mother's breast milk. The mother's breast milk, has a lot of vital nutrients and antibodies that is going to protect the child even after that. But this protection is not going to continue for so long. There is going to be a transition period where the child will have to function on its own. There is a transition where you are from your mother's protective embrace, facing the world all alone. For example, around 5-6 months, if the mother is feeding, and after that, when the child is facing the world, you have a seasonal change during that time. There is cold and cough, there is virus everywhere, there is germs in the air. For example, you have a family, when there is a child there, you have another family member having cold and cough. It is going to be, seconds or minutes, the child is going to get exposed to that air.
In school, I mean, when my son was in kindergarten, every week one child will have cold, and then it will be like a round robin.
Right?
Everybody
will get it, right? So it is a fraction of second that, fraction of minutes that the child is going to get exposed, and obviously the child is going to get that. It doesn't mean that, here I would want to reiterate this point, when the child is catching a cold or a cough or a fever, it doesn't mean that their body is failing. It is that the immune system is training. Only through these episodes, only through these exposure to the virus, the germs, the bacteria, the immune system is under the training process. First the immune system has to get exposed to a virus or a bacteria, and then the body will know to produce their own defense mechanism against that virus. Okay, this is how a immune system learns, adapts, grows stronger over the period of time. But how will you, when you're overprotecting your child inside your house, without any exposure of your child to any of this external world, how will even an immune system grow? right? So that is the point. So just like, for example, if we take it, while we go to a gym, we have a little bit muscle. When we go to a gym, we exercise it, only after that, we get a muscle stronger, right? When you go and leave a child in a school, initially the child doesn't know anything, but through knowledge, through learning and practice, the child knows a lot of things. So just like that, the immune system has to get exposed. That is my point here. The immune system has to get exposed to what? To the external world. I'm not asking you to go allow your child to go into dirty environments. Not like that. Just an external exposure. Just like that. If the child is getting exposed, because it's everywhere. Germs are here around us.
But doctor, these days I hear about a lot of kids who have wheezing and dust allergy, and immediately when they start swimming, falling sick. And I see a lot of parents curtailing that in order to protect the child. You're saying that should not be done.
Yes, definitely. See, falling sick is a normal part of the growth development in a child. It is not that falling sick means your immune system is failing. I'm telling you again. It's not, doesn't mean that. Your immune system is under the training process. So it has its own way of, learning the virus, learning the pathogen, producing a defense mechanism against it, and it also has a ability of keeping it in that memory. At the next time when it is going to encounter the same kind of virus, it knows how to fight it off.
What is the core difference between allopathy and homeopathy? And do you, as a homeopath, recommend allopathy for child to a parent at any point of time during a treatment?
For this, to explain this point, let me come here, like, parents, as soon as the child has a fever, as soon as the child has a cold, cough, they go for antibiotics, they go for fever reducers. The moment a child has a fever, what do you mean by fever? Fever is a rise in the body temperature. What does it mean? The body inside, your immune system inside is fighting off the invader, the germ. So the response of the immune function is what you have a rise in your body temperature. What is a cold? When a virus is affecting you, your nasal area is congested, the congestion is forming, so you have an inflammation, so you have a phlegm protection. So the runny nose is something that your body is trying to expel it out. When you have a cough, what does it mean? The cough is your body's impulse to expel the phlegm out. Okay, so when your throat is infected, there is an inflammation, there is a phlegm production, so your body is trying to expel the phlegm out. So immediately what do? You go take a fever reducer, put it. I'm not against fever reducer. Decide when to give. There are certain signs, there are certain red flags, red signs that the immune system is failing. Okay, that is when you can take a painkiller or take a fever reducer, okay, but not immediately, not as soon as you see your child having a fever, having a cold. What does it do is, you are interfering unnecessarily with the body's natural healing response. That should not be done, is my point.
So you're saying an antibiotic actually deactivates or shunts the growth of the child's immune system?
Immune response, yes, definitely. But to tell that very clearly, antibiotic does not work for viral infections, for flus. Antibiotics is something for bacterial infections, it works for that. But nowadays, you give a fever reducer, it is going to reduce your fever for 6 hours, then again the fever is coming, right? Has any fever gone immediately? The body is still fighting the invader.
But doctor, if pediatricians are prescribing antibiotics to infants, to children, I mean, see, why would any pediatrician do it? Is it because the parent is actually intervening?
Parents are very anxious. Even to me, parents are very anxious. My child is having fever from yesterday, since morning. See, the body is fighting, and you cannot throw the fever outside until the body is going to resolve on its own, or going to get back to its original space. You can do thousands of things to help your natural healing response. You can choose homeopathy. I will come to that later, how homeopathy supports the natural immune response. But see, pediatricians are giving antibiotics, pediatricians are giving fever reducers, because that is their line of treatment. Okay, but what I'm not here to comment on why are they doing it, but I am here to tell that what does antibiotics do? What does a fever reducer do? But you as a parent need not be over anxious and over fearful, because here the parents are becoming dreadful, not even fearful. My child is having fever. See, fever is something, a common thing that the child has to face in their early childhood, right? Whenever they are getting infected, whenever there is a germ invading their body, the immune response has to fight. Suppressing this kind of infections with fever reducers, antibiotics, the immune response doesn't know how to work. It is by thereby going to get weakened and weakened. This is going to give a long term situations like going on with wheezings, further other situations.
Is it possible, doctor, that the parents' fear of illness actually debilitates the child's mental makeup during an illness?
Of course, the child is seeing the parent. I even have people, my patients telling that the mother checks the temperature every 10 minutes. The child is watching it, right? So what does that mind of that little child, something big is happening to me? That kind of fear is instilled at a very young age. There are so many other things, health issues, there are so many other big health issues. But I want to tell people that these are very very little issues. They're very common part, the normal part of the child's development. This fever, this cold, this cough, everything. And it is like a little bit patience, knowing about your child, how the body is responding. Leave the child, it is going to get back. The fever is going to reduce. Even if you're giving medicines every 6 hours, the fever is going to come, and you're going to give the fever reducer for 3 days, and the fever is still being there. After 6 hours it's going to reduce. So why are you giving? Why don't you wait for 1 or 2 days to see whether the body is going to respond, whether the fever is going to reduce on its own?
So, what temperature until which can we wait?
Yes, there are certain red flags, where the temperature is above 1 or 2 and it is not at all reducing even after the second day, is when you can take a call. And when the child is continuously coughing, which means the chest is influenced, that is when you can take your child to a doctor, check whether the chest is influenced, because if there is a lot of phlegm, the child might have breathlessness. So there are certain red flags where you can actually take a call and bring the child to the doctor and do the needful.
And I also see an increasing trend of nut allergies, food allergies among younger children. And and a very funny thing, COVID, the COVID babies, I don't see any. I see all the babies carrying hand sanitizers in school bags.
Oh my God, this
Before eating,
over-sanitizing.
after eating, they put it, and like 4-year-olds, 5-year-olds, they're like sanitizing. It's like I've seen it.
That's an amazing point, because I even see parents carrying the sanitizers even now to my clinic. See, sanitizing is important. Okay, we understand the parents mindset, like you want your child to be protected, okay, but overprotecting, over sanitizing, that is not going to help. See, for an example, you see a child in a normal environment being healthier than a child who is being overprotected like this. Nowadays parents choose AC malls, AC indoor place, AC schools, thinking that this is going to protect my child, this is a safe environment, but not, definitely not. If you're not going to give the chance of your child's immune system to grow by allowing it to get explored to this normal environment, then you're stunting your baby's immune system, definitely. And this will leave a lasting inflict on your body's natural healing responses.
Until what age from infancy does a immune system actually learn and grow? Or is it like a lifelong process?
It is definitely a lifelong process, but the initial years are very very important, because the foundation is very important. So when you're allowing your child to just be the way they are, and this over restriction to diets, when parents come and say, I don't give my child the juice, I don't give my child ice creams, I don't give my child chocolates. I understand there are so many adulteration nowadays, but how will a child have taste preferences if you stunt your child with all that is available? You and me, we have had this, chocolates, we have had this, ice creams in roadside. I am not telling that, go and indulge your child with every roadside shops, not like that. But now and then you have to give your child chocolates, ice creams, because sweets, everything, because the child will have to know their taste preferences, what they like, what they dislike. You are, it is basically the parents mindset, I would say, which is not allowing the child to be the way they have to be. A child is a separate entity. The parents think that, the whole responsibility lies on them, and they are becoming over anxious and over fearful, which is really difficult to see.
At what age, from infancy onwards, 1 month, 2 months, at what age can a parent introduce a baby to a homeopathy?
uh, it is as young as days, even one day, even pregnant women's, it is very very safe to, take homeopathy. See how homeopathy works, how homeopathy supports, I would really want to tell it here. Because, when you choose homeopathy, homeopathy's way of looking into a condition is, it doesn't interfere with the body's natural healing response. What does homeopathy do? It goes and just stimulates the body's natural healing response to work in its most efficient way, most effective way. So for example, to be very clearer, you know if a child is having a nasal congestion, a nasal block, a homeopathic medicine is chosen so that, it clears, it thins out the discharge, so the child is free from the nasal congestion. If the child is having cough, there are so many stages of cough: dry cough, wet cough. So a medicine is chosen according to the symptom, and then when the medicine is given, the cough is, as I told you, is an impulse to bring out the cough, right? So the medicine makes the cough more productive, allowing the phlegm to come out very easily. So the homeopathy doesn't work the opposite way. It works along with the natural healing response. So the moment you start treating your child with homeopathy for every infection, it is going to add on. It's going to support your child's, healing responses, immune system even more stronger, even more effective. So there are chances of, when your child is treated under homeopathy, there are chances of lesser frequencies of infections, lesser severity in the infections. That is how homeopathy supports.
And how long does it take for a homeopathy course to actually kick in? And what is the usual journey of you starting a homeopathy treatment for a child?
See, for child, Rashmi, what we look into is, when they come for a cold and cough, I can't tell that, it is going to work after 2 or 3 days. No. Depending upon their severity, I'm going to give them the doses, and the strength is chosen accordingly, so that, it gives them the needful relief as soon as possible.
I remember, during one of our seatings, you had spoken about, done a lot of inquiry around personality.
Yeah.
How
That
does
comes,
that
that
impact?
comes, that comes, when we see, like, when the child is having a weaker immune system, as I told you, right? What is a healthy immune system? What is a weaker immune system? When the child is getting frequent infections in a month, okay, and the infections are very severe, when it is becoming more progressive, then we say that, that child is having a weaker immune system. So homeopathy can be given to promote the, to stimulate the immune system, to strengthen the immune system. That is when we have to understand the child's personality also, because it is not the condition alone we are looking into, it is the child we are looking into. So we have to understand the child's personality, like their physical constitution, the mental makeup, whatever stress they are going through at home, or their environmental factors, their family situations, everything, so that, we know, okay, this is what is the child about, and this is what is causing the, basically to find the root cause.
Do you also speak to parents in this?
Absolutely. Parents, yes. So we also ask about the, how the child's, bowel functions are, how the sleep are, how the child's, urine functions, everything. And then about their mental makeup also.
Are there any restrictions on what you can or cannot eat while being on a homeopathy medication?
Nothing like that, Rashmi. There is no food limitations. The only concept is that, as you see, the homeopathic medicines comes as small pills. You just have to instill them on the tongue. So when you have a strong taste in your mouth, that can interfere with the medicine's action. So you just have to make sure that you leave 15 to 20 minutes gap between the food and the medicine. That is all. I don't, but many people say like coffee and nothing like that. Medicines will still work.
Doctor, these days I see. I mean, recently my friend met his school friend, and his child is on the spectrum. And off late, I've been hearing a lot of kids being on the spectrum. What is happening? Like, why is this happening? Why are so many children on, or is it that we are just labeling children to be on the spectrum? What is it?
See, they autism spectrum, ADHD spectrum. See, all this. What I have seen in my practice, I would like to share it with you, because every doctor has their own kind of experience. To me, after this COVID phase, where the child has been put into household because of the fear of exposing them outside, overprotecting them inside, and they didn't have a chance to talk a lot, because it's during the initial phase where the child listens, the art of listening, the art of speaking, everything, the brain activity happens in the early years. So when the child is was put inside, locked inside the room because of this COVID, I see a lot of kids who are born during that and born and developed like initial 1 to 2 years have developed autism ADHD spectrum.
And what is the cause?
What is the cause? If you ask me, like, see, it is a different kind of a brain activity, like, ADHD is attention deficit hyperactive disorder. So autism, there is a lot of spectrum. The child, it is that their brain works in a different way. Okay, so you just can't, there are so many things like sugar is causing, sweets are causing, there are so many things, but there should be definitely a predisposition of that child to have this condition, is what I would say. Might be a genetic predisposition, or something that mothers taking vaccines. We just can't, Rashmi, point that this is because this is what has caused this child this. There is no such definite things, but whatever that I am trying to tell you is, with my experience, what I have observed, kind of a pattern.
And can you actually support kids with on the autism spectrum in living a relatively normal life?
In homeopathy, absolutely yes, because you would have seen there are so many homeopaths who are also homeopaths who look into only autism and ADHD. There are so many doctors. Because why homeopathy can support this is, homeopathy looks into the whole constitution of the child.
So what do you mean by constitution?
Constitution is, our physical and mental makeup, we as a whole. See, when we compare you, you are also a human being, I am also a human being. But what differentiates you from me? I also have two eyes, I also have a nose, mouth, organs, the same organs. But you are different, I am different. We are unique. So, how is that? Because, my genetic genes are different. My, physical build is different. My bowels work in a different way. My respiration works in a different way. Everything is different. My mental makeup, what I am getting angry for, what is my fear, what are my emotions, everything is different. So without understanding that, how would actually a treatment work? Just looking into the symptoms. If you are having a migraine, I am having a migraine, homeopathy cannot give the same medicine for you and me. For your migraine, it's a different medicine. For me, it's a different medicine. So that is how homeopathy looks into. That is what is called a constitution. The whole thing, physical, mental, and emotional makeup.
There is a concern I've heard multiple times with respect to homeopathy, which is there a use of steroids in homeopathy medicines?
That is definitely a myth, Rashmi, because there are so many things that's going around homeopathy, because there are steroids, and that is why it's acting, and it has sugar, so it causes diabetes. Nothing like that. See, homeopathy medicine, if you are taking homeopathic medicine from a plant based, if the source is plant based, the medicinal properties are alone removed. That is, the process is called potentization succussion. It is prepared in a way that all the crude properties of that medicinal element is removed, and only the medicinal property is diluted, and it is given that proper succussion to a place where it reaches a minutest form. So the lowest minute dose works the best is what homeopathy. So homeopathy is the law of minimum dose, works on the law of minimum dose. So that is why you cannot have a side effect in homeopathy. But these things are all, they have steroids, they've all people have made up around homeopathy. Nothing true about it.
Okay. Uh, Doctor, uh, I just wanted to understand with respect to childcare, what would be the one thing that you would really like to convey to young parents or to parents, and on deciding how to help your child grow into a healthy human?
Yes, you have to know, the parent first has to know that, what is a healthy immune system, what is a weak immune system. You really clearly have to know the difference. A healthy immune system is, as soon as your child gets a fever or cold and cough, don't think that, because I have parents who have come to my clinic telling that my child was good for 6 months, just 7 months baby, 6 months he didn't have a fever, now the child has a fever, give him treatment. No, which they think that, a healthy immune system is, the child is going to get fever, the child is going to get cold and cough, but the number of frequencies, the severity of the infections, if the child is, not able to cope up with the infection, is when you have to wait and see how the child is coping up. That is when you have to go for a support. Okay. And the patience in healing is what the parents should know, because it is not an overnight process where you can build the immune system in your child, give this, your child will be immune. You can always go for natural thing, giving them ginger, turmeric, everything, but it is a process. Give that time. It is working, it is developing. You just need not go and see every now and then that my child is healthy. The patience is very very important, that is one thing. And you have to know when to take support for your child, and you just have to allow the child to be the way they are. And do not overprotect, do not over sanitize, do not over restrict the child. Just allow the child to enjoy their own world. Every child has the ability of building their own immune system, so you need not worry about it at all. You just have to support whenever there is a need. You take a call. As a parent, you take a call.
Thank you, doctor. This was a very nice conversation, and I'm sure it's going to be very helpful to a lot of young parents. I'll see you again in the
Thank
next
you so
episode.
much, Rashmi. Thank you for bringing this topic. Thank you so much.
I would love for the viewers to ask questions if they want to understand how homeopathy works on specific diseases. So, if there is a particular need, please share on the comments, and I would love and to get you responses from Dr. Gayatri for your queries.